health. The nurses' strike entered its 5th day with a glimmer of hope for health workers.
Now, this happened as the National Hospital Insurance Fund says medical bills for health workers admitted to public hospitals will be waived.
That as the government made a promise that the COVID-19 vaccine will be free once it gets to the country.
Well, this on a day that the country recorded 673 new COVID-19 positive cases.
5 days on, nurses and clinicians across the country continue with their strike in the push for better working conditions. With the lack of quality and adequate personal protective equipment, the COVID-19 pandemic has complicated matters for healthcare workers who continue to succumb to the disease. Dr. Stephen Mogusu and Victor Kipngetich Tion lost their lives this week, each leaving behind a hospital bill of over 2 million shillings. Now the government is taking its first step in supporting healthcare workers who contract the disease.
All healthcare workers who are admitted in government hospitals for COVID, their bills would be waived.
Those admitted to private hospitals may have to carry their own burden. COVID-19 cases are on the rise in different parts of the world, but there is hope with the development of dozens of vaccines. The Pfizer-BioNTech, Oxford AstraZeneca and Moderna are the main vaccines. Developed countries have ordered millions of COVID-19 vaccine doses. In Africa, neighboring Uganda has ordered 9 million doses of the Oxford AstraZeneca vaccine and targets to vaccinate 9 million of its population. Egypt has already received its first shipment of China's Sinopharm vaccine. Morocco plans to vaccinate 80% of its adults and has ordered China's Sinopharm vaccine. Kenya is conducting trials on the Oxford AstraZeneca vaccine, its best bet due to cost and storage capability.
For the negative temperature storage, we can be able to manage the minus 20 degrees negative temperature storage down to our sub-county levels as it is now, and so we're ready for that. We're doing the mapping of our volumes and being able to do the necessary capacity strengthening to be able to manage that.
The government says it is looking to the global pooled procurement to get vaccines for at least 10 million Kenyans. The jab will be free.
The country is putting in place measures to resource mobilizing to be able to avail these vaccines to Kenyans at no cost.
The government knows the estimated number of people who will get the COVID-19 jab and how the vaccine will be stored. But without the funds, it may be acting ahead of itself.
Now, staying in the health sector, despite putting